Now let's talk about some usual questions which a doctor will ask a patient, or maybe you will have to ask a patient in your advanced career. Questions. Haben Sie einen Arztbrief? Arztbrief is a very important term for you. Arztbrief is a letter written by a doctor where all the details regarding the diagnosis and the medicines which are prescribed, it's all being shown in a Arztbrief. So usually in Germany, when a patient is going to a hospital, he will definitely have a Arztbrief with him. So his family doctor will have described all the physical or health backgrounds of that particular patient. It is with this Arztbrief that you should go to a hospital or to any referred doctor. So the doctor might ask you, or the patient, haben Sie einen Arztbrief? Oder haben Sie eine Überweisung dabei? Überweisung is a reference. A doctor might refer a patient to a specialist. So that letter is known as Überweisung. And the first question that the doctor will ask a patient is, welche Beschwerden haben Sie? Beschwerden, complaints. Magenbeschwer, Kopfbeschwer means complaint. And then if he wants to untersuchen, to examine the patient, he will say, machen Sie den Oberkörper frei. Remove your dresses from the upper part of your body. Or he might ask you, sind Sie einmal operiert worden? Passiv. Have you been ever operated? When was that? It all belongs to the medical history of a patient. Then he will ask the patient, leiden Sie an chronischen Erkrankungen wie Diabetes? Do you have chronic diseases like diabetes or Hochblutdruck, high blood pressure? The medical term for high blood pressure is hypertension. Sind bei Ihnen Allergien bekannt? That is a typical German sentence. Sind Sie bei Ihnen Allergien bekannt? It just means, are you allergic to something? Are you allergic to some food? Are you allergic to some medicines? But look at the construction. It's very, very typical of German language. Oder haben Sie eine Lebensmittelunverträglichkeit? Lebensmittel, Food, Ernährung, Unverträglichkeit, vertragen, to digest, Unverträglichkeit, which you cannot stand. That means, are you allergic to some food items? Next, very important question. Wie schlafen Sie? How do you sleep? What the doctor means is, do you get a good sleep? Können Sie gut einschlafen? Can you sleep in? Can you fall asleep without any problem? And once you fall asleep, können Sie durchschlafen? Can you sleep through the night? Can you sleep well? Leiden Sie an Schlafstörungen? Do you have sleep disturbances? Oder leiden Sie an Schlaflosigkeit? Do you have sleeplessness? Nehmen Sie Beruhigungsmittel ein? Is it Beruhigungsmittel means tranquilizer? It's different from sleeping pills. So, do you take tranquilizers before your sleep or during the day? If you have a very flattering or if you have a very disturbing mind, Nehmen Sie Schlafpillen ein? Do you take sleeping pills? Wen sollen wir im Notfall anrufen? In case if there is an emergency, whom should we call? Whom should we ring up? Haben Sie Probleme mit dem Stuhlgang? Have you problems with your motion? Stuhlgang is to pass the motion. Wasserlassen, it's a term which you may not have learned in your Sprachunterricht. Wasserlassen is to urinate. So do you have any problems to pass your motion or to pass urine? Nehmen Sie Abführmittel. Abführmittel is laxatives. Laxatives usually people take when they have constipation, when they cannot go to the toilet and pass the motion freely. So in order for that, do you usually take laxatives? Haben Sie Verstopfung? Are you suffering from constipation? Haben Sie Kau oder Schluckbeschwerden? Kauen is to chew. Some people, especially old people, they cannot chew because they have problems with the jaws. Then the doctor will refer you a dentist, Zahnarzt. So have you problems with Kau oder Schluck? Schlucken is to haben Sie Schluckbeschwerden? Schlucken is to swallow things ein. If there are some unwanted growth in your throat, you will have pain and you may not be able to swallow things. So the doctor will definitely ask you such questions also. Then, gibt es in Ihrer Familie besondere schwere Erkrankungen? This is a very important question because the doctor is trying to find out whether there has been cancer cases or some other cases in your family. Because if somebody is having such cases in the family, the chances of inheriting such diseases are very high. So this is an inevitable question in a hospital. Then a similar question, woran ist Ihre Mutter, Ihr Vater gestorben? How did your father or mother die? They are trying to find out mainly whether your mother or their father died of cancer or some other diseases like liver cirrhosis. Another very important term, Gesundheitszustand. Zustand is a position, condition, health condition. These sentences are inevitable in your profession. You will have to say today or tomorrow to your patient, der Zustand Ihrer Mutter oder Ihres Vaters is leider kritisch. The condition of your mother or your father is critical. Or der Zustand Ihrer Mutter is zufriedenstellend. It's satisfactory, nothing to worry. Now the following sentences are also very important after a OP. OP in German is usually referred for operation. So after operation, he will be brought to his Stationszimmer. He will be lying in his bed, but he will not be fully awake or conscious. In such cases, you have to say, Ihr Vater ist wieder ansprechbar. Ansprechbar. That means you can talk to your father. He can understand and he is in a position to talk. Or they might say, Ihr Vater ist noch nicht ansprechbar. He is not fully conscious. He is still under the influence of the anesthesia. And after that operation, you may have to ask your patients, not you may, you will have to ask your patients, brauchen Sie Hilfe beim Aufstehen? Do you need help when you get up off the bed? Brauchen Sie Hilfe bei der Toilette? If you want to go there and sit, do you need any help? Brauchen Sie Hilfe beim Waschen? By washing your body. Beim An- und Ausziehen, Anziehen is to put on dress, Ausziehen is to remove your clothes. Shall I help you in such matters also? Haben Sie häufig Harndrang? Harndrang is a 100% medical expression. Drang is an urge. Harn is urine. Harndrang is the urge to urinate, the urge to pass urine. So that also you will have to find out. Häufig, every now and then, do you feel like passing urine? Then some unpleasant situations might come. The patients or the relatives will keep on asking you questions. Then you may have to say, Mehr darf ich jetzt nicht sagen. I am not permitted to say much on this matter. Über die Diagnose und Therapie müssen Sie den Behandelarzt fragen. About the diagnosis and about the following treatment. I am not permitted to say that. Please ask the concerned doctor. Können Sie den Schmerz oder die Schmerzen aushalten? Can you suffer the pain or is it out of control? Then come some expressions which you must say to your patients under all situations, consoling them. That is a very important part of Pflege. Then you have to say, keine Angst, don't worry, everything will be all right. Das schaffen Sie schon, you will make it. This is only a temporary phase. Jetzt entspannen Sie sich. Just relax. Seien Sie unbesorgt. Forget it, everything will be all right. Don't get worried. Es ist nicht so schlimm. It's not bad. It's not bad at all. Now we come to some particular expressions which you need in an Operationssaal. Operation theater. Before the operation, you may have to ask, or the doctor will ask, haben Sie für die OP alle Unterlagen? You will have to submit many papers before the operation. Unterlagen, documents. Documents regarding your blood check, your X-ray, your lab reports, everything. And unless these Unterlagen documents are full, the operation will not be conducted. Important person, the Narkosearzt, Anästhesist. Kommt gleich, he'll come before the operation. Now be very careful. There are two sentences. Wir machen Sie jetzt für die OP fertig. Now we will make you ready for the operation, to put on the proper clothes, to shave, remove the hair from some parts of the body, as the doctor says, and all that. All these things are understood as to make a patient ready for operation. Usually they say, wir machen Sie jetzt fertig. We will now make you ready. But some patients who are not well aware of the German expressions, they might get worried. Because wir machen Sie jetzt fertig, that means we will finish you now, finish you off. Such a meaning is also wir machen Sie jetzt fertig. Please keep that in your mind.